Hi everyone, my name is Marine Banjarjian and I am a student at the West Coast University Los Angeles campus, also known as the North Hollywood campus. Last term I was in intermediate med-surg and nutrition, and this term I will be going to OB, maternity nursing, med ethics, and disaster management, which I'm all very excited for because it's a new beginning. Today I'm going to be talking to you about healthcare-associated infections, methicillin-resistant Staphylococcus aureus. Sorry, I do apologize for the board. I didn't realize if the words would be flipped because of the way I'm videotaping on my MacBook. I didn't have anyone to videotape, but nonetheless, let's continue. Worldwide, hospital-associated infections affect about 8% of hospitalized patients in Europe and 6 to 12% of patients in the U.S. And it also affects 2 million people in the U.S. annually. And what's important is that it can also lead to morbidity and mortality in our patients, such as in 1993 in the United Kingdom, it was documented that fewer than 50 deaths were related to healthcare-associated infections, and it went up to more than 300 in 2014, which is a pretty high number. So what are hospital-associated infections? In general, it could be from a patient's stay in the hospital due to medical or surgical purposes. The most common are urinary tract infections due to prolonged catheter use, or lower respiratory infections due to pneumonia. It can be skin and skin-related infections or bloodstream infections. Those are the top 4 common. They're mostly associated to Staphylococcus aureus, which is a bacterium that is found on our skin or in our nose in generally healthy people. But when you're hospitalized, it could also gain antibiotic resistance. So if you're using too many antibiotics, the bacteria can mutate and turn into MRSA, which is seen in a lot of hospitals globally. So MRSA does cause morbidity and mortality in patients and extends their hospital stay, and it leads to increased hospital costs, which is something that we don't want and we want to prevent. So as nurses, it's very important that we play a role in our patients' care and do proper hand hygiene, make sure that their catheters don't stay in too long to prevent the urinary tract infections, and make sure that they're always, coughing, deep breathing to prevent pneumonia as well. So MRSA and hospital-associated infections are a global issue worldwide. Incidences of MRSA ranges from high to more than 20% in countries such as the US, Australia, Japan, Israel, France, Italy, Spain, and the United Kingdom, to as low as 5% in the Netherlands, Sweden, Denmark, and Switzerland. So MRSA is a generally highly communicable disease, and it has the capacity to lead to an epidemic. So some ways that as nurses we want to prevent that is to identify and isolate the carriers, make sure that we prevent transmission by correct isolative precautions, hand hygiene, all of the standard precautions, and work with the healthcare team such as the doctors to reduce the antibiotic use of our patients, which can lead to MRSA and the healthcare-associated infections. So globally, some factors that are seen in every hospital across the world, because there's hospitals everywhere and there's a chance for these infections all the time. So something that increase the transmission and the risk of our patients getting these are the contaminated ventilated systems, use of medical devices such as catheters and ventilators, and which I found was interesting was a disproportionate nurse-to-patient ratio, which can maybe lead to cutting corners for nurses, which is something that we do not want, and not providing the correct and proper patient care that we want. And something else that I found interesting was the actual physical layout of the facility in the hospital. So in some hospitals, it could be that the beds are too close together, or just in general, the layout. So just to wrap it up, I chose this topic because I think it's very important as nurses to be active in our patients' care, and it affects millions of patients worldwide. And this is actually something that can be prevented in the hospital, so who better than the nurses to implement such good precautions for our patients? And I also chose this because I love educating my patients. I love talking to my patients. It's probably one of my favorite things to do, and I think as a student nurse or as a future nurse, for us to be educated with these infections, I think it's important to educate and prevent them. So I think that wraps up my video presentation of today. I will include the links in the bottom for you guys to look at. And thank you.